Hi, I'm Dr. Joanne Lynn. I'm Director of the Center for Elder Care and Advanced Illness at Altarum Institute. And here today to talk with you about the importance of patient activation and how you can achieve it in your community. It is very important that you get past how patients are usually forced to be passive in our care system. They're sort of told what to do. The doctor gives orders. They go somewhere and they get a lab test and they're expected not to ask a lot of questions. It turns out that people living with serious chronic illness have to become the experts in their own situation. If they can't, then their family member needs to be. But one or another needs to be taking charge of their situation, especially during a transition. So during a transition from one settled system, maybe a nursing home, to home care, or from a hospital to a nursing home, they need to know what to expect, what kinds of things could go wrong, how to stop the system and make sure that things that are going wrong get back to right. And that requires coaching patients and families in how to be effective in the care system. First, you need to know how passive is this patient. Some patients are just overwhelmed, or they've been trained to see themselves as ineffective. You need to boost them up. You can start with the patient activation measure, which you can find online, and then work with improving their performance in terms of how competent they feel in managing their own life. There's also a coaching model that's been developed called the Care Transitions Intervention, which is sponsored by Eric Coleman and his group at the University of Colorado. And using that kind of coaching, you can teach people how to be effective in their own care system. These are very effective, often outside of the reach of what most doctors and nurses think about, but they really do work, and I hope you'll look into them. Thank you very much.